Okay, so we will continue from brain injury. Brain injury. Okay, so with a brain injury, it can either be the types. It can either be closed or open, right? It can either be closed or open, right? Working at the emergency for some years, there are people who are involved in an accident, and sometimes they will come. You will see the skin fall off, and then you only see the scalp, right? That one is less severe, so with that you can just suture, and then that will be it. But where sometimes the skull is open, sometimes you can even see the brain, right? And that is when, if the person is not rushed to the theater immediately, the person can die due to hypovolemic shock, and then alteration in level of consciousness and all that. Okay, so with the closed injury is also known as blunt injury, closed or blunt head injury. Closed or blunt head injury. It occurs when the brain accelerates and then rapidly decelerates or collides with, and then the brain tissues damage, but no opening through the skull or the dura occurs, right? So let's assume that your head hits a wall, or somebody gives you a knock, right? And then the brain moves within the skull. So the brain can hit the one end, and then it will come back and hit the opposite end, right? So this type of injury is what we term as closed or blunt brain injury, right? But with open brain injury, it occurs when the object penetrates the skull and then damages the underlying tissue, right? So where there is an accident and sometimes somebody will come, the skull is already open, the brain is out, right? So that is the open brain injury, right? So with the closed injury, it's just the movement of the brain inside. The skull most of the time is not affected, but still the brain can be damaged, right? Depending on the movement, right? So it moves, hits one side, and sometimes it's depending on the intensity, it can hit the opposite side. And then sometimes there can even be bleeding, internal bleeding with the skull intact, right? Okay, so let's look at the types of brain injury or the classifications. We have the first one we'll talk about is concussion. Concussion, right? So concussion, this is a type of head injury which results in temporal loss of neurologic function without any structural damage, right? So there is damage to the brain, right? So most of the time is the CNS signs, the person will exhibit central nervous signs and symptoms, right? Without any, probably can't see any skin, damage to the skin, damage to the skull, but there is an injury to the brain, right? It may result from an acceleration, right? Where the brain moves, hits one side, and then sometimes it hits the opposite side, right? So it can lead to signs and symptoms depending on the part of the brain that is damaged, right? So the signs and symptoms that the person is exhibiting depends on the part of the brain that is damaged, right? Right. So if the frontal lobe is damaged, then the person will, depending on that, right? So depending on where the damage is occurring, right? So the person can exhibit bizarre, irrational behavior if the frontal lobe is damaged. And then there can be amnesia and disorientation if the temporal lobe is damaged, right? Sometimes there can be, if the temporal lobe is damaged, it can affect the ear, and then if the occipital lobe is damaged, it can affect vision, right? So it depends on the exact part where the damage is occurring, right? Okay. There can be grades, right? But you can read on that. Depending on the severity, it can be grade 1, concussion, grade 2 concussion or grade 3 concussion, depending on the severity. Let's look at the second type. It's known as contusion. Contusion. Right, contusion. Okay, so with a contusion, this is the type of brain damage leading to bruising of the vessels, right? So with this type of brain damage, the vessels are involved, right? So sometimes there's opening of the vessels and then it can lead to internal bleeding, right? So it mostly occurs at the anterior portion of the frontal or the temporal bones, and it may be characterized by loss of consciousness, confusion, cerebral edema, and then sometimes the patient may have hemorrhage, right? So there can be subdural or subarachnoid hemorrhage. Okay, so temporal contusion is more dangerous than frontal contusion most of the time, right? If the injury occurs at the temporal part of the head, it's more serious than the frontal contusion. Okay, so contusion is bruises of the surface of the brain, typically accompanied by small diffuse venous hemorrhage, right? So that is what I said. So it can lead to subdural hemorrhage, subarachnoid hemorrhage, right? So bleeding in the brain. Okay, the next type of injury we will talk about is laceration. Laceration. Okay, so scalp laceration are extremely common head injuries, yet is diagnosed as often missed, right? So with the laceration, sometimes you have people fighting and then one of them can use a cutlass and then cut the head of the other person, right? So this type of injury to the skull is what you term as laceration, or we can have any blunt object piercing through the skin and then of the skull and then opening the skin as well as affecting the skull bone, right? It is mostly associated with penetration or depressed skull fractures. So sometimes these lacerations can cause penetration, or it can even lead to depressed skull fractures where the skull bone moves inside and then compresses on the brain, right? Okay, and then it can also lead to acceleration and then deceleration, where the brain hits the one side and then it's bounce and hits the opposite side, right? Okay, so there are several forms of brain injury. We also have the fourth one known as the diffuse axonal injury. Diffuse axonal brain injury, right? So with the diffuse axonal brain injury, there is a wide spread of forces that produces damage throughout the brain, right? So there is damage throughout the brain. The forces, so it means that it's not one force, right? So somebody who is assaulted and then receives several blows on the various parts of the brain, right? So this person can have several brain injury, and this type of brain injury is what you term as diffuse axonal injury. Diffuse axonal injury. So lesions may also be found in the corpus callosum. I told you to review the anatomy yourself, right? So lesions can be found in the corpus callosum, midbrain, upper brainstem, etc., right? So throughout the brain. Okay, and then we can also have intracranial hemorrhages, right, depending on the severity of the injury. Hematoma, there can be hematoma formation, right? And hematoma is a collection of blood in the brain tissues, right? The name of the hematoma will refer to where the blood is accumulated, right? So depending on where the blood is collected, will determine the name of the intracranial hemorrhage, right? So If it is above the dura, it is termed as epidural hemorrhage. And if it's below the dura, it is termed as subdural hemorrhage. Right? So epidural hemorrhage means that the blood is collected above the dura, and then subdural hemorrhage means that the blood is collected below the dura. Right? Okay. It can also lead to aneurysm, right? Aneurysm is where the vessels is not open, right? So the blood vessel is not open, but there is a weakening of the blood vessels. So there will be collection of blood in that weakened part, and that is what we term as aneurysm, right? And it's also one of the serious conditions. If craniotomy is not done, it can also lead to stroke, right? So it's also a serious condition, right? And then it can also affect the intracranial pressure, right? Bleeding in the brain can also affect the intracranial pressure. So let's look at the diagnostic investigations that can be done for someone with head injury. You can do CT scan most of the time. You can do MRI. You can do positron emission tomography, X-ray of the skull, etc. Right? Depending on the severity, sometimes lumbar puncture and all that can also be done. Okay, so I was talking about increased intracranial pressure. What are the signs and symptoms of increased intracranial pressure? Any patient with an increased intracranial pathological condition is potentially at risk for increased intracranial pressure, right? Yeah, so conditions of the brain, conditions of the cerebrospinal fluid, conditions of the blood can affect the intracranial pressure. The normal intracranial pressure is about 10 to 15 millimeters per mercury. The normal intracranial pressure is about 10 to 15 millimeters per mercury for adults. And then children is around 3 to 7 millimeters per mercury, right? And then infants is around 1.5 to 6 millimeters per mercury, right? So if you have any injury to the brain, to the cerebrospinal fluid or the spine and the blood, it can affect your intracranial pressure. So there can be increase. It will be above the normal, which is the 15, above the 15 millimeters per mercury. Okay, so let's look at signs and symptoms of let's look at causes of increased intracranial pressure first. So you can have brain trauma, you can have intracranial hemorrhage, you can have brain tumors, you can have infections of the brain, including meningitis, encephalitis. You can have congenital abnormalities like hydrocephalus. You can have stroke, ischemic stroke, and then hemorrhagic stroke, right? They can all affect the intracranial pressure. Brain abscess, right? And other conditions like hypoxia of the brain. Sometimes even posture, right, can affect your intracranial pressure, right? Someone who rotates the head over and over, sometimes it can affect your intracranial pressure. Then seizures can also affect the intracranial pressure, right? And then certain drugs like tetracycline and others can also affect the intracranial pressure. So these are the factors that affect. And if somebody is already at risk of increased intracranial pressure, these are the things that you should avoid. You should avoid oral